Zoloft is one of the most commonly prescribed antidepressants in the world. Approximately 40 million prescriptions are written each year over the past 10 years. And so it's thought to increase the body's level of serotonin, which is thought to help people keep calm and help with depression, help with anxiety. Actually, it's indicated for several psychiatric conditions: anxiety disorders, depression, post traumatic stress disorder, social anxiety, premenstrual dysphoric disorder. Why is it one of the most prescribed medications? Not really sure. Maybe it's the marketing done by the pharmaceutical company. In fact, a lot of people do not have a good response from this medication. In regards to depression, it's thought that maybe 1 every 5 people, 1 every 7 will actually get treatment from it. But oftentimes this is prescribed in case that person or that patient is 1 of the 5 or 1 of the 7 that will respond to this medication. Also, the placebo effect is shown to be really important in healing and health for somebody. Actually, they have found that people who have committed suicide have low levels of serotonin in the spinal fluid. It's thought that maybe if the body responds better to serotonin, that could help prevent suicide. So that's why these are often prescribed as well. There's a lot of serotonin in the stomach and intestinal area. And so it's not surprisingly then that upset stomach, nausea, constipation, diarrhea, these are the most common side effects when starting this medication. You could start at a small dose and gradually build yourself up, like maybe over a few days or weeks, to minimize those chances of side effects. Oftentimes, after a few days, those side effects will go away. Some other side effects that may occur from taking this medication include sexual side effects, such as decreased libido, low sexual energy, or low sexual drive. What you can do in these cases is you can ask your primary care doctor or check with your medical doctor about ways to get around this, such as other medications like Viagra or Cialis. Or you can try not taking the medication for that day in which you do plan to have sexual activity and just resume it after the sexual activity. Some other side effects that are important to know with this medication, especially in people with bipolar disorder, is that it could increase the chance of a manic or hypomanic episode. So if someone takes this medication and they notice they cannot sleep, they get a lot of energy, their mood swings up to very euphoric or happy, or they get very irritable and cannot sleep for several days, that could be a sign that one has a bipolar disorder, and probably not a good idea to be on this medication at that time. Other patients tell me that this medication causes them to be sleepy, and so you can try cutting back on the dose to see if it helps with the energy during the day. If someone is on other psychiatric medications with this drug, it can get a little bit complicated. There can be a rare condition called Serotonin Syndrome, in which there's too much serotonin that is produced in the body, and the patient can get really hot, muscle cramps, diarrhea, sweaty, flushing. It can actually get really intense to where they get really dehydrated, maybe get confused, and they need to stop all their psychiatric medications. Oftentimes they're admitted in the hospital, need IV fluids, and it takes them at least a few days to recover. But if not addressed, it actually can be life-threatening. So what about this risk of suicide in people under the age of 24? Well, there's some conflicting studies that show this medication actually does not increase the chances of suicide in people under 24. I've heard some theories that people who are depressed get started on the medication, then they have more energy to carry out the plans to commit suicide. But again, we find that people who have committed suicide typically have low levels of serotonin in their spinal fluid, and so it's better in those instances to be on a medication like this to prevent suicide from happening, or to try to prevent it. Lastly, I'm going to talk about the different doses of medication. Usually the starting dose can be 50 milligrams, but you can start as low as 25, and it can go up to 200 milligrams. Typically, you want to start slow and then go up high. For conditions like anxiety or post-traumatic stress disorder, it's typically going to take higher doses to address that. Caution is people with anxiety typically have more sensitive to side effects of the medications, and so for those reasons the medications are started at a smaller dose and slowly work their way up. It can take up to 4 to 12 weeks on this medication, and really on a lot of medications similar to this, to notice the optimal effect. So you do have to give it some time. Although if the anxiety is really bad during that time, you can often get another medication prescribed that you can take along with this one, as this one builds up in the bloodstream. And the reason it's thought to take so long is because it makes changes into the genes of the person, the genome, and so that is thought to take a while to take effect.